Okay, we're going to finish the chapter dealing with alcohol, chapter 5. This should be a shorter lecture than last time. We'll see how this goes. Anyway, I don't have very many stories, so it shouldn't take too long. Alcohol leaches minerals from the body, leading to a greater risk of fracture. Myopathy, muscle inflammation, can be caused by chronically imbalanced electrolytes due to alcohol consumption. Dilation of blood vessels near the skin can lead to a chronic reddish complexion, while the toxic effects of alcohol may lead to thinning of the skin, acne rosacea, psoriasis, eczema, and facial edema. The reality is that alcohol will go to the surface of your skin and it will actually dry it out. And that's one of the reasons it's a vasodilator. And so since it dilates the blood vessels, a lot of times what will happen if somebody's a chronic alcoholic, their nose will turn red, and this is known as acne rosacea. But it will burst the blood vessels in their noses and give them a red nose, um, which is always interesting. And of course, it gives you facial edema, which edema is fluid buildup. So it'll make their faces look puffy. It all sounds quite attractive, I'm sure. Heavy drinking disrupts the immune system, but especially white blood cells, making the individual susceptible to infections. If you've ever been around alcoholics, they seem to always have a cold, or if there's a cold in the area, they pick it up, or if the flu's in the area, they get the flu. They're more susceptible to tuberculosis, and this is one of the reasons why tuberculosis, we almost eradicated tuberculosis, but it stayed active in the homeless population. If somebody has tuberculosis, it's a bacteria, and it needs to be controlled. Otherwise, you can infect a lot of people. So one of the things that we do in the United States, I think this is done all over the world, is that if somebody has tuberculosis, the law dictates that they have to take antibiotics to knock it out. Otherwise, they'll infect other people. And it's a law. And if they won't do it, you lock them up and give them their medication. And the medication, you have to take the medication for an extended length of time. I mean, 6 months to a year to knock out the tuberculosis. Tuberculosis used to kill, thousands and thousands of people every year. It was almost like coronavirus. And it was a cough, just like coronavirus. And of course, pneumonia is another problem that these individuals tend to suffer from. Chronic heavy use of alcohol can make the individual a great deal of fun. They tend to have memory problems. That's a joke, and that's a cruel, cruel joke. But they tend to have memory problems, hallucinations, paranoia, severe depression, insomnia, intense anxiety, amnesia, and blackouts. If you watch the old cartoons, they used to talk about people seeing pink elephants and whatnot. The reality is the hallucinations that people have are not quite that benign. Most people see snakes, they see spiders, they feel insects crawling on their skin. This is also known as delirium tremens, and we're going to talk about this in just a second. They have amnesia, they have blackouts due to the damage of the frontal lobe and the hippocampus. The individual often has problems with concentration and implanting new information in the brain. So as their alcoholism gets worse and worse and worse, they tend to black out more. They can't remember things. They can't concentrate on things. They can't drive anymore because, well, they can't. They tend to run off the road. I mean, all kinds of horrible things happen to these individuals. On the average, heavy drinkers reduce their lifespan by 15 years, which is a really, really long time. There are 140 million drinkers in the United States out of 365 million, about 360 million. So a lot of people are drinkers. Of those, 10 to 12% become alcoholics. That's about 14 million. 14% of the male drinkers and 6% of the female drinkers will become alcoholics. Men become alcoholics at a younger age than women. They tend to start drinking earlier than women do. 20% of all drinkers, heavy drinkers, consume 80% of all the alcohol. Let me underline that. This is really important as far as if I were a maker of whiskey or vodka, then I would understand that the people that I need to attract are these 20%, not the 80% that drink 20% of the alcohol. You know, that's not going to get me, that's not going to make me a millionaire. What's going to make me a millionaire is by attracting these 20% of all drinkers, of all heavy drinkers, consume 80% of the alcohol. So I need to attract these guys, because these are the guys that are drinking a fifth of whiskey a day. My dad was not much of a drinker. My dad would buy a bottle of whiskey. He was in the Army Reserve, and he would go off to his reserve training in the summertime, and he'd be gone for 2 or 3 weeks, and he'd come back and he and his friends would have drunk about 2/3 of the bottle, and so the rest of that third of the bottle he would put underneath the sink, and he would take a nip from time to time. And I'll tell you what, he could drink a whole fifth of whiskey in a year. Heavy drinkers will drink a fifth of whiskey in a day. That's the way it works. You know, they're heavy alcohol drinkers. These are the ones that you want to attract. Who cares what my dad drank? He only drank one bottle of whiskey a year. But a heavy drinker will drink 365 bottles of whiskey in a year. So they're the ones that you need to attract. Alcohol production and usage has been controlled by financial factors since before the beginning of the United States. And just like slavery, its detractors have been screaming into the wind. People in the North complained about slavery from before the United States was the United States, and it took them until 1865 to get rid of slavery. People in the South turned a blind ear. Well, they do the same thing with alcohol. Founding Father Dr. Benjamin Rush warned of the deleterious effects of alcohol as early as 1804. Dr. Thomas Trotter was coming to the same conclusions at the same time, but their ministrations fell on deaf ears. They don't listen to it. 1941, Dr. E.M. Jelinek and Carl Bowman developed a classification of the different forms of alcoholism. Now remember, this is in 1941. 1920, Prohibition went into effect. 1932, it was repealed. So this is in 1941. This is less than 10 years after the repeal of Prohibition. The comfortable classification of alcoholics has changed over time as the understanding of the addiction process has progressed. According to a recent reclassification by the National Institute on Alcohol Abuse and Alcoholism, constructed in 2007, there are 5 subtypes of alcoholics based on 6 different criteria. Family history is one criteria. Age of onset. These are the criteria, and actually there's only 5 criteria. It's very confusing. Family history, age of onset of drinking and problem drinking, patterns of craving and abuse, use of additional drugs, and mental condition are the 6 criteria. Subtype 1, young adults. 31.5% of U.S. alcoholics are of this subtype. They are characterized by relatively low rates of simultaneous drug abuse and other mental conditions, low rates of family alcoholism, and they rarely seek any kind of alcoholic treatment. Subtype 2 are young antisocial drinkers. 21% of U.S. alcoholics are young antisocial alcoholics. They are usually in their mid-20s with precocious onset of regular drinking and alcohol-related issues. Over 50% come from families with alcoholism problems, and about 50% have an antisocial personality disorder, and a major depression, bipolar disorder, and anxiety problems. Over 75% smoke cigarettes and marijuana, and a large percent also have cocaine or heroin addictions. More than 30% of them look for help. Subtype 3, functional alcoholics. Functional alcoholics represent 19.5% of U.S. alcoholics. Usually they're middle-aged, well-educated, with stable jobs and families. Approximately 33% present a multi-generational family history of alcoholism. About 25% presented major depressive illness during their lifespan, and about 50% were smokers. Let me tell you a quick story about functional alcoholics. We had a captain when I was in the service. This guy was quite a drinker. He married a doctor. She knew that he was an alcoholic because he drank all the time. But most of the time you couldn't detect it, and he would use mouthwash to cover the odor of the alcohol. The only And he worked in a hospital, so there's alcohol all over the place. There's alcohol smells all over the place. So the only people that could smell it were people from the emergency room, who were used to smelling ethyl alcohol when it was in the area. Anyway, one day, this is in Germany, one day he ran off the road, and it wasn't his fault, and it wasn't because he was drunk, but the Germans don't mess around. The Germans don't ask you if you want your blood drawn to find out what your blood alcohol is. They just do it. And that's exactly what they did with this guy. And of course, he was upset, and he tried to sue the German government. He can't sue the German government. That just doesn't happen. Anyway, his blood alcohol came back as 0.275. And like I said, they didn't know he was drunk, but he ran off the road. There was alcohol in his car, and they drew his blood. There were indications that possibly he had been drinking, and it turned out that his blood alcohol was four times drunk, 0.275, and of course 0.08 is the legal limit. Even in Germany, it's a legal limit. So he was drunk, and he was very drunk, as according to the figures. But as it turns out, he was such a functional alcoholic that he could function exceedingly well with a really high alcohol level, because he'd been doing it since he was 10 or 12 years old. And he was a skinny guy. He's married, like I said, he was married to a doctor, and she claimed that he was a functional alcoholic, and that nothing should happen to him because he was so functional that he needed the alcohol in order to maintain his function. And of course, eventually he was kicked out of the service. Died about 5 years later of cirrhosis of the liver. There's a shock for you. Subtype 4, intermediate familial. 90% of U.S. alcoholics are intermediate familial alcoholics. They're middle-aged and coming from multi-generational alcoholism. About 50% have presented clinical depression and 20% bipolar disorder. Most of them smoke cigarettes, and about 20% abuse cocaine and marijuana. Just 25% looked for a cure. And this is really kind of interesting. This idea that they're multi-generational alcoholics. Now you have to remember that Europeans are professional drinkers. They've been professional drinkers for centuries, for hundreds and hundreds of years. The reality is, if you're an American Indian, then you've only had alcohol around you for about 400 years. But if you're a European, you've had alcohol around you for thousands of years. So Europeans tend to drink more, to be able to drink more. They're able to tolerate alcohol better because of these problems. And certain areas of Europe have more of a reputation of drinkers. The Irish, for example, the Germans drink a lot of beer. The French drink a lot of wine. The Italians drink a lot of wine. So when we say multi-generational alcoholics, and if you watch movies from about England, or if you watch movies about Germany or France or Ireland, of course, there's always drinking involved, and it's always really, really hard liquor. Anyway, that's where the multi-generational alcoholism comes from. Subtype 5, chronic severe alcoholics, about 9% of U.S. alcoholics can be categorized as chronic severe. The majority are middle-aged individuals with early onset of drinking and alcohol-related issues, with high rates of antisocial personality disorder and criminality. Criminality. 80% presented multi-generational alcoholism. They were the most prone to psychiatric conditions and drug abuse. 70% of them looked for help, forming the main category in alcoholic treatment. The coexistence of psychiatric and drug abuse issues were linked with severity of alcoholism, the date of beginning the treatment. Help seeking was found to be relatively rare, people choosing mainly to attend Alcoholics Anonymous meetings and participate in other 12-step programs. So they didn't try to get formally cured, they tried to cure themselves for a couple different reasons. One, it allowed them to relapse whenever they wanted to, they didn't have to be tortured with a program. And they could attend the Alcoholics Anonymous and pretend that they were trying to fix themselves. Family studies have shown that there is a hereditary influence on alcoholism. The same genes that potentially lead to addiction also may express a proclivity to become an alcoholic. And of course, that would be DRD2A1, the same gene that causes people to become to jump out of airplanes and to do all kinds of crazy stuff. That's the adventurous gene. If you have this DRD2A1, then you're more likely to become an alcoholic as well. But people who drink may have several other genetic anomalies that might lead to alcoholism. Many Asians have an ALDH2 gene that encodes aldehyde dehydrogenase. Because the person doesn't have as much of the enzyme to rid themselves of toxic alcohol, they become ill when they drink. Half the Japanese and many other Asians have more efficient alcohol dehydrogenase and less efficient aldehyde dehydrogenase, which leads to a buildup of acetaldehyde, which in turn creates toxic levels of acetaldehyde, resulting in, remember, acetaldehyde is very similar to formaldehyde. So you can imagine what this stuff does to you. It causes them to have flushing. Their cheeks turn red almost immediately. Tachycardia, which makes their heart beat really, really fast. That's what tachycardia means. Tachy means fast, and cardia means heart, fast heart. Headaches, edema, and hypertension and vomiting. And that's why Japanese make such bad alcoholics. Other indicators that what I mean is they're not very good at it because they can't drink a whole lot. Other indicators that heredity strongly influences alcoholism is such characteristics that run in the families or groups, such as tendency to have blackouts, greater initial tolerance to alcohol, an impaired decision-making area of the brain, a major shift in personality during drinking, and impaired ability to learn from mistakes, retrograde amnesia, low level of response to alcohol, cirrhosis, and alcoholic psychosis. Major shift in personality during drinking. Most people, when they drink, they get happy. I have had alcohol before in my life. I've been drunk 3 times in my life. And I become introspective, and I'm the kind of person that cries into their beer. That's why I haven't had a drink since 1976. It kind of makes me depressed. So why in the world? I mean, I'm not real bright, but I'm smart enough to know that depression isn't a lot of fun. So why in the world would I drink alcohol to get depressed? The environment that an individual inhabits can have a strong influence on whether they drink alcohol. Factors that can lead to alcohol abuse include child abuse, alcohol or other drug abusing parents, friends or relatives, chaotic familial relations, peer pressure, and extreme stress. And of course, if you're a teenager, Peer pressure is the strongest decider as to whether you're going to drink or not. All the other things can lead to that, but a lot of times it's peer pressure that causes the individual to start drinking. One of the most powerful environmental factors in alcohol or drug abuse is sexual, physical, or emotional abuse at a young age. In one study looking at 275 females and 556 male alcoholics, 20% of the men and 50% of the women said that they had been subject to physical or sexual abuse as a child. 20% of men and 50% of women. When someone drinks alcohol, their brain-body neurochemistry changes. The brain-body will try to protect itself from the effects of alcohol by developing a tolerance to the substance. The drinker will develop metabolic tolerance by metabolizing the alcohol more efficiently. The liver of the drinker will manufacture more enzyme to break down the alcohol, and the metabolite acetaldehyde, that's poison that alcohol turns into in your stomach. This also accelerates the breaking down of other drugs, including prescription medications. When someone drinks alcohol, their brain-body I've already said that. Pharmacodynamic tolerance takes place in the brain when brain neurons and other cells become resistant to the effects of alcohol by increasing the number of receptor sites for GABA in the brain, becoming less sensitive to alcohol. Behavioral tolerance occurs when the drinker learns to handle their liquor, changing their behavior to make it more acceptable and acting in a way to hide their drunkenness. Hangovers represent the individual's withdrawal reactions to the alcohol. 85 to 95% of those experiencing withdrawal will have only minor symptoms: rapid pulse, sweating, increased body temperature, hand tremors, anxiety, depression, insomnia, nausea, or vomiting. I used to work with a guy that was an alcoholic, and he would come in after a bender the night before, and we would have to give him coffee after coffee after coffee, trying to get his hand from shaking because we were drawing blood. And with a shaky hand, with hand tremors, he couldn't draw any blood. He was not too bad when he was sober, or when he wasn't having a hangover. But I'll tell you what, we had to pump the coffee into that guy to get his hands from stop his hands from shaking. And once we did, of course, he was fine. Not a happy person. He was. The funny thing was that when he had a hangover, he was a grouchy bastard, is what he was. But as soon as he sobered up to some extent, as soon as the hangover dissipated, he was a pretty nice fella. Liked being around him. He was funny. He's not funny when he had a hangover. He was just miserable. And of course, lucky me, because I'm more tolerant to people's different behaviors. I always got paired with him because nobody else wanted to deal with him. Bastard. Anyway, we all survived. And I drew most of the blood until his hand stopped shaking. 5 to 15% will experience life-threatening major symptoms of withdrawals: tachycardia, transient tactile, auditory, or visual hallucinations and illusions. This is really, really important, because this is how they sell alcohol, with these auditory or these visual hallucinations. Remember the pink elephants that I was talking about before? That's what they're trying to do. They're trying to get people they're trying to scare people into drinking, and that's how they advertise alcohol, by using by tying into people's visual hallucinations. Psychomotor agitation, grand mal seizures, delirium tremens. These are the withdrawal symptoms. For individuals going through alcohol withdrawals, delirium tremens and seizures are the most severe and life-threatening effects. If you are an addict of one kind or another, the most dangerous addiction you can have, as far as trying to clean up is concerned, is alcohol. People die from alcohol seizures far more frequently than they die of anything else. They overdose on opium, but they do not die from the withdrawal. Cocaine, same way. Methamphetamine, the same way. People rarely die. It's like having the flu. I know we just said this about COVID-19, but yeah, it's like having the flu. But alcohol is a lot more severe, and you're going to see the statistics in just a second. Before modern medications to ease the suffer, 35% of people going through severe symptoms died. 35% died trying to get off alcohol because they go into seizures and then they die. We didn't have any way of controlling it in the past. Now we do, but we still lose a lot of people who are trying to get off of alcohol. With the modern techniques, the mortality rate still approaches 5 to 15%. And if they try to do it themselves, it increases to 10 to 20%. Now, normally before they die, they will go to the hospital and then we will treat them for their seizures. But we still lose 10 to 20% of the individuals who are trying to withdraw from alcohol. And even in treatment, 5 to 15%. We will lose 5 to 15%. Delirium tremens usually begins 48 to 96 hours after the individual's last drink. The DTs can last from 3 to 10 days, with some serious cases extending into 50 days. This is painful, and this is what kills people. And for that reason, a lot of people, they will get off the booze and they will start going through the withdrawals, and then they'll just go back because it's just too painful. Individuals who have gone through the DTs before seem to fear the powerful and frightening hallucinations if they suffer more than any other symptom. Remember, it's the hallucinations. The hallucinations are not pink elephants. They're not fuzzy kitties. They're monsters. They're wolves. They're ghosts. They're anything that you can think of. That is the horror that these individuals are going through. Whatever you're afraid of, that's what your hallucinations will be about. Severe symptoms develop after prolonged heavy drinking. 48 to 87 consecutive days of heavy drinking can cause severe symptoms. And now we have these pictures. Wait a second. Let me blow this thing up so that you can see some of. So what they do is, you can look at this picture, and Johnny Walker's trying to sell his red label, his whiskey. Johnny Walker's trying to sell his whiskey, but remember, 20% of heavy drinkers drink 80% of the alcohol. So they want people to buy this every day. They want them to drink a lot of alcohol. So the people that are heavy drinkers are also the ones that are addicts. And since they are addicts, if they've ever gone through delirium tremens, then monsters are very scary to them. So what they do is they'll put monsters in the pictures. Wait a second, let me do this again. As you can see, there's something going on right here. Why in the world would they have flames in a whiskey advertisement? What is this? Can you see any monsters in here? Well, if you were a heavy drinker, you could see monsters. There's maybe a face here. Usually they put them in the ice cubes. So let me do this again, and I'll blow this thing up. We'll see if we can find something. Whoops, I'm sorry, that's not right. Let me see if we can find something in the ice cubes. We're looking for faces of monsters or scary things. And they can be upside down. There's something right there. Yeah, there's probably something right there. I don't know if Johnny Walker scares us or not. But we also have the flames over here. Why they would put the flames in here? Unless it's to hide horrible monsters and faces. That's pretty scary, whatever that is. Right? Okay. Ghosts, wolves' heads, dragons' faces. Okay, let's look at another one. This is Jack Daniels. It's out of focus. Not a very big picture. Okay, there we go. And usually, like I said, they put the faces in the ice cubes. I don't see anything with that one. And we'll try this as Gentleman Jack. Let's see something. Oh, that's something right there. There's something over here. It could be an alligator, I guess. Oh, Gentleman Jack is made by Jack Daniels again. So a lot of times you can look in these and you can see faces. Let's see, monster. I don't know what that is. It could be something. Anyway, so you can look at these, and those of us who aren't alcoholics, and I'm sure none of you are alcoholics. We go, come on, there's nothing in there. I'm making all this up. But if I was an alcoholic and I saw this, just looked at this, it would remind me of delirium tremens, or maybe something down here. I don't know. So anytime you see a whiskey advertisement or a vodka advertisement, especially if they have a glass with ice cubes in it, then see if you can see some kind of a monster in there. Beer advertisements rarely do anything like that, but the heavy drugs or the heavy alcohols tend to do that. Okay. Anyway. So I'm telling you, I mean, that's what they do. And of course, they claim that they didn't do anything. It's just a shadow in the ice cubes. It doesn't mean anything. But the reality is they're trying to keep people drinking. Drinking alcohol creates a neurotransmitter crisis in the brain because alcohol increases the effectiveness of GABA. Those are subliminal messages, by the way. And they're not subliminal messages for you or for me because we're not alcoholics. And we don't get the delirium tremens, and for that reason, these messages aren't for us. It's for those heavy drinkers. Because alcohol increases the effectiveness of GABA, which blocks the chemicals that induce energy, the person becomes drowsy and the bodily functions become depressed. The brain, however, compensates by increasing the energy chemicals and creating a state of hyperarousal. When withdrawal takes place after heavy alcohol usage, the hyperproduction of the energy and the good feelings chemicals reverses itself, and they are produced at lower levels than normal. So here's the problem. So when you drink, it makes you feel good, and when you're not drinking, it makes you feel you're producing less of these chemicals than you were before. The other thing is GABA. Remember, GABA has to do with anxiety. One of the ways we cure anxiety is by giving you chemicals giving you pharmaceuticals that increase your GABA level. Now, all of a sudden, when you're not drinking, guess what? You become paranoid because you develop anxiety. The feel-good chemicals, norepinephrine and serotonin, are increased when you're drinking. So when you're not drinking, you feel worse, and you're producing less of these. So in order for you to feel normal, you've got to drink. And then all of your neurotransmitters, the ones that make you feel good, the ones that keep you from having anxiety, will increase, and you will feel much, much better. So the only way for you to feel normal is to drink. And that's one of the problems with alcohol. Serotonin, norepinephrine, GABA, they're all increased when you're drinking. So that's a good way to take away your anxiety. It's one of the reasons. I was watching a movie the other night, and this guy said, I need a drink because he had just murdered somebody. And of course, he needed to drink because he had all this anxiety. So when he drank, he increased his GABA level and took away his anxiety. And this is why they say that in the movies, or they need a cigarette. The cigarette increases their dopamine level. The dopamine makes you feel good, and that takes away all the bad feelings. The decrease of energy chemicals causes tachycardia, anxiety, increased muscular activity, hypertension, and seizures. The activity of serotonin is a good example. Serotonin is reduced 30% when heavy drinkers stop drinking, causing anxiety and depression during withdrawal. anxiety, and depression. Okay, so how in the world do you ever feel normal again? Well, you take a drink. You take a shot of hair of the dog. That's what caused your problems to begin with. So the more you drink, the less depressed, the less anxious you are. You try to get clean and sober, you get depressed, and your anxiety levels increase. Over the last century, many sociological experiments have been conducted to reduce the effects of alcohol abuse. We raised the drinking age. The drinking age in Europe is 16. In the United States, it's 21. In Canada, it's 18. Techniques to lower the child abuse in the home, limiting the sale of alcohol, working to lower the stress in everyday life. The United States went through prohibition from 1920 to 1932, but they didn't in Canada. So the drinking problem in Canada is a little bit more acute than it is in the United States. Most illicit drug users also drink. Most alcohol abusers use other drugs. A study in Europe in 2003 found that of the 600 adolescent drug users, 80% used both marijuana and alcohol. Similar study in the United States of adolescents in treatment found that 96% used alcohol with other drugs. A study in 2006 in the United States found that among heavy drinkers, 32.2% used illicit drugs at the same time. 80 to 95% of drinkers also smoke cigarettes, while 70% of alcoholics are heavy smokers, as compared to 25% of the general population. Kind of interesting, I used to play softball on a co-ed softball team, and our third baseman didn't drink unless it was after a softball game where she did really well. And then she'd drink beer, but she couldn't drink beer unless she smoked a cigarette. As weird as that is. Why the two went together, I'm not exactly sure, but she was kind of interesting that way. Tobacco and alcohol are used to facilitate social situations. When alcohol and marijuana are used together, it accelerates relaxation. Drinking before using cocaine will prolong and intensify the effects of the cocaine, though it increases the predisposition for violence. Alcohol will facilitate an individual's ability to come down off of methamphetamine. Compulsive gamblers drink while gambling or gamble while drinking, and of course the two addictions go together. Unfortunately, many times people with mental disorders will use alcohol to relieve their symptoms. I need to take a drink of lemonade, not of alcohol, of course. Among men and women who are alcohol dependent, 4% suffer from bipolar disorder, 4 times the figure for the general population. 5.3% of the general public suffer from major depression, while 28% of people diagnosed with alcohol dependence suffer from major depression. And as we saw before, it reduces your serotonin level by 30%. So you have to keep drinking in order to stay happy, to feel normal. 16.4% of the general public suffer from anxiety, while 37% of alcohol-dependent people suffer from the malady. However, it is difficult to draw direct parallels between alcohol and mental illness, because the effects of alcohol mirror or can create mental problems. Heavy drinking disrupts the neurotransmitters in the reward pathway that lead to feelings of well-being, opioid peptides, dopamine, serotonin, GABA, as we have said before. In one detox center, 70% of alcoholics were originally diagnosed as suffering from depression. After abstinence of a month or more, the depression diagnosis had dropped to 30%. So as you can see, the two go together. So here's your problem. You got an alcoholic who has a mental illness. Which do you treat first? And the answer is you treat the alcoholism first. You need to get them off the juice before you can figure out whether they really have a psychiatric problem. Any psychiatric diagnosis must always take into account the possibility of drug-induced symptoms. Just like if you have anxiety, one of the things you need to look at is how much caffeine are they taking in. Is it the caffeine that's causing the anxiety? Same way with alcohol. Individuals diagnosed with antisocial personality disorder show symptoms of impulsivity, lack of remorse for causing harm, inability to learn from mistakes. These same symptoms are found in drug abusers, including alcoholics. 80% of those diagnosed with antisocial personality disorder develop substance dependence. There's a shock for you. It's the only way they can feel normal. If a mother drinks during pregnancy, especially the first trimester of her pregnancy, there is a great possibility that the alcohol will do damage to the fetus, and she is more likely to miscarry and to cause infant deaths. Alcohol intake during pregnancy is a leading cause of intellectual disability in the United States. This is really kind of interesting because while I was working in Omaha at St. Joseph Hospital, St. Joseph Hospital was connected to Boys Town Institute. Boys Town Institute did research on all kinds of interesting things, but one of them was fetal alcohol syndrome. And the individual that was doing the research on fetal alcohol syndrome used to come down to the lab all the time. He used to put things in our incubators because his incubator, he would fill his incubators up and he'd come down and he would use our incubators. So we got to talk to him a lot. And the funny, I guess it's not that funny, but the guy was an alcoholic, which was kind of interesting. But one of the things that he would talk to us about was how his research was going. And this was back in the early 80s. And we weren't exactly sure what fetal alcohol syndrome was, or this was in the middle 80s. And they had just first diagnosed fetal alcohol syndrome in the early 1980s. And here he was doing work with it. And of course, nobody had a clue. It takes time to figure all these things out. And he was working with fetal tissue. He was working with tissue from aborted fetuses. And part of his research, he was trying to figure out why the fetuses were so damaged from the alcohol. And what he discovered was, he was the one that discovered that alcohol has an affinity for brain tissue. Now, this is especially true with babies because they have such a small amount of brain tissue. Now, you can, whenever somebody drinks, they get drunk, and the reason is because it affects their brain. But you can imagine if this is an immature structure, how, since it has an affinity for brain tissue, because it is fat labile and water labile, it crosses it crosses into the brain blood barrier. But that's what he discovered. And he was the first one to discover that alcohol has an affinity for brain tissue, especially in infants. And we're going to see the effects of alcohol on the baby's brain. Surveys of pregnant women in the United States shows that 12.4% drank some alcohol during several months of their pregnancy. 4% used in binge patterns. 0.7% were heavy drinkers. 18% smoked cigarettes. 4.3% used illicit drugs at least once. One of the reasons he was doing his research in Omaha is because there's 3 Indian reservations just north of there. And fetal alcohol syndrome was first detected on the Pine Ridge Reservation, and those are Sioux in South Dakota. But these guys that we were dealing with, or that he was dealing with, I wasn't doing the research. He was doing the research. But the individuals that he was dealing with were Winnebagos and Teton Sioux from northern Nebraska. Anyway, that's one of the reasons why he was there and doing his research in Omaha. Boys Town Institute, of course, Boys Town was run by the Catholic Church, and St. Joseph Hospital was owned by the Catholic Church, and that's one of the reasons why we were doing the research there. It's really kind of fascinating. Anyway, what am I talking about? Okay, so 12.4% drank some alcohol. We're talking about pregnant women in the United States. 12.4% drank some alcohol during several months of their pregnancy. 4% used in binge patterns. 0.7% were heavy drinkers. 18% smoked cigarettes. 4.3% used illicit drugs at least once. One study of 293 infants born with fetal alcohol syndrome and alcohol-related neurodevelopmental disorders in Portland, Oregon showed that 89% were using alcohol with at least 2 other drugs. 49% were using alcohol with cocaine. 100% were smokers. Most were single mothers. Most were high school dropouts. Most had a history of sexual and or physical abuse. Many had a history of drug or alcohol abuse in the family. Many had learning disabilities that may have come from substance abuse effects when they were in the womb. So that's a study done in Portland, Oregon. As you can see, the women that they were dealing with had lots and lots and lots and lots of problems. In a study of FAS at the University of Washington, 2 groups of infants were followed into adolescence. By the age of 5, 38% of the children's biological mothers had died of alcohol-related causes. 38%, that's over 1/3 by the time the kids were 5 years old. By the time the group reached adolescence, 69% of the biological mothers had died of alcohol-related causes. So that's almost 70% were dead by the time the kids were teenagers. Alcohol consumption during pregnancy can cause 3 varying degrees of problems. Fetal alcohol syndrome, which is retarded growth. Facial deformities, problems with heart and limbs. Central nervous system involvement, potentially lowered IQ, with a range of 20 to 120 with a mean of 79. 79 is barely above intellectual deficits. Alcohol-related neurodevelopmental disorder, aND, and alcohol-related birth defects, ARBD. All 3 of these problems are referred to as fetal alcohol spectrum disorders. And this is what it looks like. Look at this kid's brain. This is what a normal brain looks like. Here's a corpus callosum right here. And as you can see all the convolutions in there. Look at that. That brain is so pickled. And of course, there's no convolutions. No wonder the individual has an intellectual deficit. And look at his corpus callosum. It is non-existent. Alcohol kills cells and changes the wiring of the fetus's brain. This is a baby with fetal alcohol syndrome. This is a normal baby's brain. As you can see, it's much, much smaller. No corpus callosum, hardly any gyri and sulci. It's just really tragic. A child who suffers from the less severe forms of FASD, aND, or ARBD may have an IQ ranging from 49 to 142, with a mean score of 90, which is just below average is 100, and that's below average. Though they will have other problems, even if they don't have a intellectual deficit, intellectual disability. They'll have difficulty with short-term memory, problems storing and retrieving information, difficulty forming links and making associations, problems making judgments and forming relationships, difficulty controlling temper and aggression, oversensitivity to bright lights, loud noises, sharp smells and textures and tastes of food. Now the problem is they often have anger issues later in life. We can see that family after family, if you've got a multi-generational alcohol use, that this can be a really serious problem. And of course, it can cause sexual or physical and sexual abuse potentially. And this just becomes cyclic, and it happens in families, and it just continues to happen in those families. Now, the interesting thing is, if we have a child of an alcoholic, guess who they are more likely to marry? They're more likely to marry another child of an alcoholic. So it just repeats itself over and over and over and over. With worldwide FAS rates range from 0.33 to 2.9 cases per 1,000 births, though the figures vary by country and the use of alcohol. In the United States, the rates are 0.2 to 1.5 per 1,000 births. Asians and whites have a rate of 1 to 2 per 1,000. African Americans 6 per 1,000. American Indians anywhere between 10 to 120 per 1,000, depending on the region and the tribe, and we're going to talk about that in just a second. The incidence of aND and ARBD are about 3 times that of FAS in all groups in the United States. The most destructive time to consume alcohol for the fetus is the 3rd week through the 8th week of gestation, when the brain is forming. The corpus callosum is forming, the basal ganglia is forming, the brain cell migration and organization are taking place, and that's one of the reasons why their brains look like this. Okay. During the 2nd trimester, the facial features are forming and can be deformed by alcohol use. During the 3rd trimester, the hippocampus is forming, which might impair the encoding of visual and auditory information. Basal ganglia has to do with your temper. We talked about the temper before. Hippocampus has to do with your short-term memory. And, of course, we talked about that before as well. The most destructive method of drinking for a fetus is to drink in a rapid manner. In other words, drinking a lot of alcohol all at one time. It is a concentration that is destructive, and drinking in that manner intensifies concentration. So we're talking about a binge pattern of drinking. Studies have shown that 7 drinks per week is the minimum baseline for negative neurobehavioral effects. But if the mother is consuming all of their alcohol in a binge pattern, the pattern becomes more important than the volume. During the growth period, alcohol contact for 4 hours is enough to kill brain cells. How long does it take to get the alcohol out of your system? Well, it all depends on how much you drink. But if you drink more than one drink, it takes you 3 hours to get rid of one drink. It takes you 6 hours to get rid of 2 drinks, and on and on and on. So if you're drinking all 7, you've got alcohol in your system for an extended length of time. And all it takes is 4 hours to start killing the baby's brain cells. The only logical drinking pattern for a pregnant woman is total abstinence, and that is something that you can take to the bank. Alcoholic fathers can also transmit mutated genes in their sperm due to the consumption of alcohol. While this can't lead to FAS, male children can suffer from other intellectual and functional deficits, impaired verbal skills, impaired thinking processes, impaired planning skills, problems with visual spatial skills, problems with motor skills, memory deficits, and learning impairment. Alcohol interferes with the main inhibitory neurotransmitter in the brain, GABA, which reduces inhibitions. People with pre-existing aggressive tendencies will become more aggressive with the use of alcohol. And this is one of the reasons why alcohol causes so many problems. 30% of the victims of violent crimes report that the perpetrator had been drinking alcohol before the offense. 15% of robberies, 26% of aggravated assaults, 50% of homicides. The perpetrator had been drinking alcohol before the offense. When arrested, alcohol levels of probationers was 0.18. That's more than twice the limit of a drunk person. When arrested, alcohol levels for local jail inmates was 0.20. When arrested, alcohol levels for state prisoners was 0.28. So as you can see, alcohol had something to do with their arrests. In a study from Memphis, Tennessee of domestic violence calls, 92% of the perpetrators had consumed alcohol the day of the disturbance. 92%. 67% of the perpetrators had used cocaine the day of the disturbance. Half had used alcohol and or cocaine often during the last 30 days. Alcohol encourages the release of pent-up anger, hatred, and desires that are normally controlled by society. The drunk's moral judgment and reasoning are impaired by the alcohol. 34 to 74% of perpetrators of sexual assault have been drinking before the assault. 30 to 79% of victims of sexual assault have been drinking prior to the assault. So the answer is, if you're going to a party and you're around strangers and you're female, do not drink, or at least drink only a little bit. If you get drunk, the probability that somebody's going to assault you goes up markedly. In 2005, 40% of the motor vehicle fatalities involved alcohol. That's 16,885. 90% of these situations involved a blood alcohol of 0.08 or higher. 275,000 injuries occurred at the same time. However, an aggressive advertising campaign and more aggressive sentencing for DUI infractions has reduced traffic fatalities by 18%. This used to be really, really serious in the United States. When I was growing up, this was a real serious problem. And of course, the people that produced the alcohol didn't want you to put those advertisements on television. But of course, eventually, after more and more people sued the beer companies and whatnot, then now these advertisements were more frequent on television. They used to have advertisements for alcohol on television all the time. They would sponsor everybody's favorite show. It's tobacco and alcohol, that's the only commercials you saw. Now, of course, you see all kinds of interesting things, but hardly ever alcohol and never tobacco anymore. So how stupid can you be? 1 in 4 drunks drive within 2 hours of their last drink. Remember, it takes 3 hours to get rid of 1 ounce of alcohol. On any given weekday night between 10 p.m. and 1 a.m., 1 out of every 13 drivers is legally drunk. On weekend mornings between 1 and 6 a.m., 1 in 7 drivers is drunk. Of convicted DUI perpetrators, 61% drank beer only, 2% drank wine only, 18% drank liquor only, 20% mixed their drinks. Most of them were drinking beer. Alcohol-related crashes cost an estimated $148 billion in the United States every year. A blood alcohol test of 0.08 is the legal limit for driving under the influence. The individual does not have to show impairment to be found guilty. As I told you, that was in Germany, of course. It is estimated that only 1 driver is arrested for every 300 to 1,000 drunk driving trips. What has worked over the years to reduce traffic deaths due to alcohol? Lowering the legal inebriation levels from 0.10 to 0.08. Imposing immediate license revocation for individuals whose ethanol levels exceed the legal limit. Increasing the legal drinking age from 18 to 21. This happened in the 1970s. It happened during the Carter administration, he was president from 76 to 1980. Maintaining zero tolerance for youth until 21 who are caught DUI. This has reduced crashes involving youth by 17 to 50%. Impounding or towing vehicles of DUIs, requiring mandatory treatment for DUI arrestees. Dram laws, those who serve are liable for customer who becomes intoxicated. 42 states have dram laws or limited dram laws. The only states that do not have dram laws: Delaware, Kansas, Louisiana, Maryland, Nebraska, Nevada, South Dakota, and Virginia. Medical reports involving alcohol. 15 to 25% of emergency room patients reported the use of alcohol, especially those involved in fights, assaults, and falls. As I told you, my mother was a nurse. She worked in the emergency room. This irritated her more than anything else, having to deal with men who came in all beat up or all cut up. But it irritated her worse when one of these guys killed somebody. As it turns out, her aunt, my great aunt, was killed by a drunk driver. She was killed, and her grandson was killed at the same time by a drunk driver. A drunk driver, what damage did it do to him? Not a thing. He lost his license for 6 weeks. Vehicular homicide. This is back in the 60s. Vehicular homicide. Lost his license for 6 weeks. Killed 2 people. Alcoholics are 16 times more likely to die in falls and 10 times more likely to be burned or die in a fire. 31% of boating fatalities had a BAT of 0.10 or more. There was a pitcher for the Miami Marlins. His name was Hernandez. He had an ERA that was just astronomical. Died in a boating accident. And as it turned out, he was the one driving, I think, and he was really, really drunk. And he killed 2 other people in the boat at the same time. 40% of the industrial fatalities, this was a couple of years ago, 40% of industrial fatalities and 47% of injuries involve alcohol. Alcoholics commit suicide at twice the rate of general population. What does an alcoholic who commits suicide look like? He's white, he's male, he's middle-aged, he's unmarried, and he has a long history of drinking. Culture determines how an individual will consume alcohol. Wet cultures such as Austria, Belgium, France, Italy, and Switzerland sanction daily use of alcohol. They integrate their social drinking into everyday life. They serve watered-down wine to children with meals. They drink more beer and wine than do dry cultures. Dry cultures such as they have in Denmark, Finland, Norway, and Sweden, those are the Scandinavian countries, they restrict alcohol use with heavy taxing. They consume more distilled spirits, more really hard liquors, 50% more. They're characterized by binge drinking, particularly males on the weekend. All 4 of these countries, if you are caught drunk driving, then you are suspended for life. You can never drive again. Mixed cultures such as that in Canada, England, Germany, Ireland, and the United States demonstrate patterns of binge drinking. They have a higher incidence of violence to women than either the wet or the dry cultures. Russia has had an alcohol-soaked culture for 500 years. Vodka is traditionally drunk between meals in large quantities. Vodka is the strongest alcoholic beverage except for Everclear, which is almost pure alcohol. But vodka is pretty damn close. It's really strong stuff. A form of prohibition, this is weird, a form of prohibition that started in 1985 resulted in illegal manufacture and 11,000 alcohol poisoning deaths. The male life expectancy actually rose in Russia during the Prohibition period when they didn't have nearly as much vodka to drink. As soon as Prohibition ended, alcohol poisonings increased to 40,000 per year, increased by almost 4 times. Male life expectancy actually dropped in 1 year by 6 years because they were drinking so heavily. In England, 70% of the population drinks regularly. 2/3 of the consumption of alcohol is in the form of beer, usually warm with darts. Recent attempts to curb the destruction of alcohol in the British public has been in the form of prohibiting happy hours, allowing the pubs to stay open past the 11 p.m. to reduce the need for binge drinking, encouraging the English to reduce average consumption to 3 drinks a day. They call them pints. They drink their stout in pints. On the average, men drink more per drinking episode than women do. Men also tend to have more adverse social and legal effects from the alcohol. Women tend to increase their drinking after they pass 30 years of age. Even when they are dependent on alcohol, women drink 1/3 less than men who are dependent. Hereditary factors seem to be stronger in women when it comes to alcohol. Female alcoholics have 50 to 100% higher death rates than male alcoholics. They have more cirrhosis of the liver, circulatory disorders. They commit suicide more frequently, and they are more prone to accidents. The younger an individual starts using alcohol or tobacco, the more likely they will have a problem with the substances later in life. 6.2% of 8th graders have been drunk in the past month. An 8th grader is 14. Yeah, they're 14. 18.8% of the 10th graders have been drunk in the past month. 10th graders are 16. 30% of 12th graders have been drunk in the past month, and they're probably 18. But they're still illegal. All of these people are illegal. The immaturity of the adolescent brain can lead to unwise decisions. When disinhibiting factors of alcohol is thrown into the mix, the individual is more likely to drive drunk, they're more likely to have unplanned pregnancies, and they're more likely to suffer from sexual aggression. Drinking during adolescence leads to limited emotional growth. The truth is that when you start drinking alcohol, your brain stops maturing. So if you start drinking at 14 and you don't stop until you're 34, your brain is still 14 years old. That's how mature it is. College students or adolescents into their junior years, 44% of our best and brightest admit to binge drinking. About half of the binge drinking college students admit that their grades fall into the C or to F range. Many also admit to missing classes on a regular basis. A national study showed a direct correlation between the number of drinks consumed per week and the individual's grade point average. Women were more sensitive to the deleterious effects of alcohol on their grades. 86% will show the same pattern of drinking that they developed in high school. How did they do it in high school? Well, here you go. 6.2% of 8th graders were drunk, 18.8% of 10th graders, and 30% of 12th graders. By graduation, the college educated drink less than their non-college attending peers. Males binge more than females, 48.6% compared to 40.9%. 50.2% of white students binge as compared to 34.4% of Hispanic students, 26.2% of Asians, and 21.7% of blacks. Fraternity residents binge at 75.4%. Dormitory residents binge at 45.3%. Off-campus residents binge at 54.5%. Married residents binge at 26.5%. College drinking leads to 1,700 deaths per year, 690,000 physical assaults, 599,000 injuries, and 97,000 sexual assaults. Intelligence about drinking doesn't increase with age. 2,500,000 Americans have alcohol-related problems as patterns develop, sometimes as a pre-adolescent, and continue into old age. Alcohol can deplete bone density, especially in women who tend to be more susceptible to osteoporosis. Surprisingly, about 1/3 of all older people who drink didn't start until they were older. Asians and Pacific Islanders have the lowest alcohol consumption rate of any of the U.S. of the major racial or ethnic groups in the United States. 4% of adult population are heavy consumers. Filipino and Japanese Americans are the most likely from this group to drink heavily. And one of the reasons is because Filipinos and Japanese have had more contact with the Americans than other Asians. Koreans have the highest number of abstainers. Of course, we've only had contact with Korea for about 70 years. We've had contact with the Philippines and the Japanese for over 100 years. African Americans have the second lowest percentage of heavy drinkers in their population at 4.2%, compared to whites at 7.4%. Only 40.8% of black males drink monthly compared to 56.5% of white males. Peak drinking seems to occur after the age of 30. Explanations for high levels of abstention among blacks may be their long history of strong spirituality and matriarchal family structure. 8.1% of Hispanic population consume alcohol at a heavy rate. Heavy alcohol use is highest among Mexican Americans as compared to other Hispanics, such as Puerto Ricans and Cubans and Venezuelans and whatnot. Past month use runs at about 46.7%. Binge drinking runs at about 25.8%. 6.2% of Hispanics can be classified as alcohol dependent. American Indians, Alaska Natives, this isn't good news, have drinking rates that greatly vary by region of the country and tribal affiliations. The heaviest drinking appears to occur among the Northern Plains tribes. That's the people that live in Wyoming and Montana and Idaho and North Dakota. Those are the Northern Plains. They're primarily Sioux, Blackfeet are up there, the Arapaho are up there, right up to the Rocky Mountains. The mountain tribes, of course, are Nez Perce and the Salish and Kootenai and whatnot. But the Plains tribes are the Gros Ventre and the Assiniboine. The Siouan tribes, the Crow, are Northern Plains tribe. Of the 10 leading causes of death, 5 are directly connected to alcohol abuse. This is the average of all American Indians. Number 3 is unintentional injuries, is a leading cause of death. Is the third leading cause of death. The fourth leading cause of death is diabetes. The sixth leading cause of death is liver disease and cirrhosis. Eighth leading cause of death is suicide. And the 10th leading cause of death is homicide. Of these, none of these exist. None of these are leading causes of death with white people or black people. For American Indian Alaska Natives, alcohol-related motor vehicle deaths are 5.5 times higher than the general population. Cirrhosis of the liver is 4.5 times higher. Alcoholism is 3.8 times higher. Homicide is 2.8 times higher. And suicide is 2.3 times higher among American Indians. And that is the end of the chapter. Very depressing chapter. Well, I guess all these chapters are pretty depressing. Don't forget, you have a paper that's due at the beginning of November. So stay safe, and I'll talk to you next week. I can't remember what we're talking about next week, but I'm sure it will be as exciting as alcohol.